Medicaid, the federal health insurance program for low-income Americans, is critical for those with substance use disorder. Medicaid cuts would pose particular risk for people with addiction. Here's some data on why. Medicaid provides coverage for nearly 14 million people with a mental health or substance use disorder. That's nearly 40% of non-elderly adult Medicaid enrollees. Medicaid is the largest payer of substance use services. In 2023, for example, Medicaid paid for about 39% of non-fatal overdoses treated in the emergency department, helping people 118,000 times in the 26 states that provided data. And in 2021, Medicaid covered opioid use disorder treatment for nearly 1.82 million people. That accounts for 35% of all people treated for OUD. More than half of those individuals became eligible for Medicaid because of the Affordable Care Act's Medicaid expansion, which broadened eligibility to people beyond those with disabilities or the lowest incomes. And states that expanded Medicaid experienced increases in the percentage of treatment, emergency department visits, and hospitalizations for OUD covered by Medicaid, and fewer people receiving care were uninsured. Cuts for the expansion population would therefore be particularly harmful. Medicaid spent an estimated $29 billion in 2023 on OUD treatment. Total federal health department spending on the opioid crisis through programs other than Medicaid accounted to just slightly more than $4 billion. The bottom line is that Medicaid is essential for providing OUD treatment to those who need it. When people gain Medicaid coverage, they are more likely to seek treatment for addiction and to receive effective care. Medicaid cuts would therefore reduce access to treatment and exacerbate the ongoing addiction and overdose crisis.